You mentioning the severe pain. What does a gout attack feel like?
The onset is very sudden. You know, someone has just been sleeping and then all of a sudden, suddenly being woken up by severe pain. The way how that person is actually describing it, he will most probably say, I've never ever in my life ever experienced pain like this yet. And they will actually even be telling you that even just the movement of the blankets over my particular affected joint was so bad. So this is that type of pain where people really are very sensitive, where they say that my joint is on fire, to the extent that they cannot even walk. Or if they dare walking, then they're constantly limping. They are not moving as smooth as what they are supposed to be moving.
Good day. Welcome to Cospharm MedTalk, a podcast where we engage healthcare experts and communities in open conversation about health, wellness, and medical insight that matters. Our goal is to share knowledge, spark curiosity, and support healthier lives together. I'm your host, Joseph. Today I'm joined by our specialist physician in internal medicine, Dr. Katjitae. Welcome, Doctor.
Thank you, Joe.
All right. Today's topic is living with gout, myths, truths, and prevention. So, Doctor, we're going to start simple. What is gout and how do people get it?
Gout is one of the many inflammatory conditions which can cause a very inflamed, painful joint disease. It can either come in suddenly and just be a once-off in your life, which actually comes in repeatedly and builds itself into a chronic condition which they call chronic gout. Now, who is likely to get it, or what are the things which can actually get it? Okay, the people who have got, there are people who are a bit overweight. There are also certain medications which we use, for instance, diuretics, which can also cause gout. There are other special medications as well, but I think diuretics is actually one of them. You have also noted in your community that it runs into families. You will often see that the one person's son, the father had it, he was working funny, he was always, when you are as a child, you were always hearing that your father is actually telling, no, I've got a serious problem on my joints. Often it's the foot which is actually affected, but it can also affect children. So there are many conditions. It's basically the weight, it's basically the genetics which plays a role, it's basically the medications, it's also the food which can actually play around. And then there are also some other associated conditions which can go on. There's a whole wide range of causes or things which will actually make you to end up with gout.
All right, Doctor, thank you for answering that. I actually wanted to know, is it only about eating rich foods and drinking alcohol, or there are other hidden factors that people should eat alcohol?
The diet matters, especially certain food types, which I can just mention very quickly. These are basically the meat, red meat, especially red meat, can actually lead to that fish. It's a bit of a surprise for many people because they thought that fish, it's actually safe to eat fish, but certain types of fish, especially, for instance, when you look at snook, but also shell type of fish, shrimps and all those things can also lead to gout as well. Actually, through the metabolism, the way how the body works it through, will actually end up provoking gout. So it's not just that, it's among diet does play a role, but there's also your people who have got more weight are actually much more prone to developing that. But there's also people, generally gout likes attacking more men, especially in a younger age, between 20 and let's say 40 years old. Whereas when you're looking at women, sometimes, people think, oh, I'm a female, it cannot affect me. But it does affect women preferably after the menopause, when they have gone beyond the protection of your hormones, your estrogen. Obviously, when you also develop certain conditions which actually leads to a lot of breakdown of purine acid, which creates more uric acid in your body. Certain types of cancers, for instance, like your myeloproliferative things. Sorry for that big word, but it's basically the so-called leukemias, the lymphomas, which will actually predispose you towards getting gout.
We often hear about acute gout and chronic gout. What's the difference and why does it matter?
Acute gout is basically something you've got to start somewhere there out of the blue. So very often you will find someone who's suddenly affected, whose joints are suddenly affected, and often it is usually the joint which is actually attaching your big toe to your foot, which we call the metatarsal first joint. That is usually the common way how joint affected. And in fact, in Afrikaans, they always say, "Dis my vein toon." But in the angetasis, or after eating meat, you will actually end up that it's basically, it's even got nicknames now in our thing, because it's a common problem which people discover that it's actually coming on that. So in fact, it actually starts off on your big toes, and then, but it's not, sometimes it can also involve two joints, and then it will actually spread to this year. But coming to the question, you said it suddenly starts off with severe pain, which is unbearable, where people will actually say that, my pain, it feels like my joint are on fire. It's pain which I cannot even tolerate, even with little movement, whether I want to move or whether even a blanket if a blanket gets moved over the two, the pain is there. So that is an acute onset which is coming there. It can actually be there for half a day and then subside spontaneously without anything. Or it can also be there and then progress for a few days. But the general story is actually that it's around about 48 hours. People take some painkillers and then it subsides, or even without painkillers, it doesn't subside. But then it's more likely to come back again. You find a second episode, you find a third episode, and then it becomes a chronic, recurrent nature, where you will actually say that now you are more likely to end up getting it recurrently. And this is a general thing, some people only get one episode for their life, but generally over the years, you are more likely to get a second episode. And if it's been there for more than 10 years, then you are more likely to end up with recurrent episodes, and you are more likely to be battling with this disease for your lifelong, unless you do something to control it, taking medications to control it, and also change something on your lifestyle. Then you are likely to have a control condition.
Someone with occasional flare-ups can end up having chronic gout if not managed properly and early.
Correct. Some episodes of gout may just be self-limiting, in the sense that they will just come and that will just be that episode. But often gout will actually take a recurring, repeated type of trend, where it starts off with a big toe, and then all of a sudden it's an ankle, and then all of a sudden it's the elbows, and all of a sudden it's actually the hands. And indeed, actually, some of the chronic gout attacks will resemble rheumatoid arthritis, other inflammatory conditions such as rheumatoid arthritis, which will actually affect the hands, the wrist, and everything, clinically looking exactly like rheumatoid arthritis. So it's actually quite important that this should be taken serious. And there are also other complications which I will most probably talk about, with kidney stones and cardiovascular risk, which are also there. But it's just to know that it's something, when you develop that, your body is actually asking for attention. It's asking for help. It's not just something which you will just ignore and say that, man, I will take my meat, or I will take my drinks, or I will just go and take my painkillers. In fact, what I've noticed in Namibia is actually that a lot of people will go and then they will go over the counter, they will buy over the counter things like your painkillers without having really had a proper diagnosis. Now, that could be a bit potentially dangerous, because there are certain other conditions which can also resemble gout. For instance, an infection in your joints could be what we will call an infective arthritis, could also be the same, present in the same way as gout.
And speaking of medical professions that help diagnose this, how does a doctor diagnose that it's actually gout and not other joint-related infections, like you've mentioned, for example, arthritis or a joint infection?
When you have got gout, the joint is actually swollen. So they can either put in a needle directly there, and then they can take the liquid which they are getting there and they look it under a microscope with a special light, which is a polarizing light, and then they see the crystals. They can actually identify the crystals because it's almost like illuminating into that. So that is a gold standard of that. But gout can simply be diagnosed by taking out blood and then looking at the uric acid level, which is often high. But mind it, some people might even be having an acute attack with that in an acute flare without the levels being raised. Or the other thing is just a simple thing, because many of you have been living in families where one or other relative have also been affected by gout.
Doc, going back to you mentioning the severe pain, what does a gout attack feel like?
The onset is very sudden. Someone has just been sleeping and then all of a sudden, suddenly being woken up by severe pain. The way how that person is actually describing it, he will most probably say, I've never ever in my life ever experienced pain like this yet. And they will actually even be telling you that even just the movement of the blankets over that particular affected joint was so bad. So this is that type of pain where people really are very sensitive, where they say that my joint is on fire, to the extent that they cannot even walk. Or if they dare walking, then they're constantly limping. They are not moving as smooth as what they are supposed to be moving.
So I wanted to find out, what are some of the biggest myths about gout that you've heard? For example, on my side, like you've mentioned, I've heard that it's just a rich man's disease. Is that true, or can anybody get gout?
We've gone beyond the time where it was rich man's disease. If you look at the history, in the European history, it was a disease which was mainly affecting kings. But we have gone beyond that. Food has actually become much more available. If you look at meat, everyone has got access to red meat. Everyone has got access to, not many, maybe not many, but even if you don't have access to red meat, you still got access to offal. And it's still the same type of way, whether you are able to afford red meat or whether you're able to afford offal, it's the same thing. So these are the things there. And everyone has actually been drinking. Have also been having an opportunity to select what they drink. And what you drink, what you very often will be surprised is people will take these sugary drinks. They will opt for these sugary drinks, which, as I say, have also got sugars which can actually precipitate to get it. And that's the same thing with the drinks. Everyone has got access to some beers. Everyone has got access to some wines. And all those things are loaded with components of things which can actually cause gout. So indeed the diet is there. So it's not just the rich man who will get it.
Are there other foods and drinks to help lower the risk of gout?
The low-fat dairy products. Remember that at times I remember that very often when we were at the farm, when we were producing fat, we will be separating that after being checking after our mothers have been checking this year, separating that fat from that. They will be taking that milk, and often that milk will actually be discarded and be given to the dogs. But this is actually the much more healthier part of the milk which you can actually drink. The low-fat milk can actually do that. But coffee has also got a protective effect in terms of actually precipitating it. And then there are certain cherries, because of their high amount of antioxidants, they tend to also decrease the episodes of gout and prevent the episodes of gout. So those are just options. But just simple, if you just take plain water, you've got the need for drinking. Don't go and take sugary, calories loaded drinks.
Other than diet, can stress, lack of sleep, or dehydration make gout worse?
So the stress is definitely a major problem, but also lack of sleep. Lack of sleep, your body is made to rest. But if you're cutting short on the rest, you are constantly overusing your body. And if you are constantly overusing your body, you need energies. And you remember the substance, the ATP, your purine, the purine products, which on the longer run accumulates and end up being uric acid. You produce too much of that. And when you produce too much in the body, your body becomes oversaturated, and instead of actually getting rid of that through the kidney, it actually, because there's just too much, the rate of production is so high that it doesn't cope up with the rate of getting it excreted in the body. You end up over accumulating. So you say, so stress, that is also there. And then you must also remember, we rely on our kidneys. We rely on our kidneys to excrete certain products, especially the uric acid. We rely on the kidneys. So if you are in a situation where you are dehydrated, where you have not been drinking a lot of water, or where you have been working in the sun, in the heat, then your body goes into a self-conserving mode where it doesn't lose any water anymore, where it keeps the water back. And when the water is kept back, the body still continues breaking down and producing uric acid, which is supposed to be getting out. But now all of a sudden, because the body is in a situation where there's not enough water, it needs to be on a self-conservation type of thing. You end up not excreting too much, not excreting the uric acid products. And those uric acid products, somehow, if they go through a specific threshold, they decide to get yourself accumulate in particular in your joints. But the kidney is also there, and your blood vessels, or your heart system is also there. And that's how it actually ends up over accumulating and causing problems.
So what happens if gout is untreated or not controlled? Does it cause lasting complications?
Yes. The first of all is actually it's a very disabling disease. And if I can't walk, I can't go to work. I can't go and sit and work while I'm having pain. So that's already a loss of income in that thing. And then if it keeps on coming recurrently, I may even end up being disabled because my joint will be damaged beyond repair.
Right, doctor. What practical steps can we take to prevent flare-ups, especially at home?
So it's actually quite important to stick to your medication. And then again, at home, you stick to the lifestyle changes of trying to maintain a good weight, trying to eat food which doesn't provoke the episodes of gout. And we know them. It's the same thing. I mean, I've mentioned it that, that why should I be taking something which is going to make me to become sick and end up in the hospital or end up being disabled? What we very often say is some people have got allergic conditions, and then they ask them, then they come and ask you, what must I actually do for this allergy to go away? Then you say, the best medicine for these things is just avoidance. Avoidance. You avoid coming into something which can trigger it, because despite all the good medicine which we can give you, there is no medication which can actually absolutely guarantee you now that you have drank your medication, you can start all of a sudden start eating rich food as what we have said. You unfortunately are just, your body is just made different. We all different people. That's the reason why the one person have got diabetes. That's the reason why the other one have got high blood pressure. They might even be from the same parents, but the one does have it and the one doesn't have it. There are certain things which you can just not change, and you just need to decide certain things doesn't work with you and you stay away from that.
Are there common mistakes people make at home when dealing with gout that could have serious consequences?
Yeah, the common mistake is actually that when they get painful attacks of joint pain, to just ignore it and just think that it's just anything, or this is just a pain. And I've mentioned that sometimes the attacks of the gout are short-lived. They, within 24 hours, they can also subside spontaneously, or even just by simple painkillers. And then you decide, man, it doesn't, 2 days later, it doesn't really deserve, I don't need to go to the hospital, I don't need to go and see anyone. So those are the things where people decide that they don't need to take medication, or they self-medicate. They self-medicate on pills, or they self-medicate on some herbal medicines. And some of the herbs themselves can actually provoke acute gout. And then they end up doing these things. Or that sometimes people take the medication which they're given for just a very short time. Once the episode is actually resolved, then they stop the medication. And in fact, the medication the anti-inflammatory medications which are supposed to maintain your uric acid levels at a lower level in a stable condition, they themselves, once you start them, they will bring down your uric acid level, but when you stop them, they will trigger a sudden raise, and you may end up with disease. So those medications are supposed to be taken lifelong, or they're being taken on a chronic basis, on a constant basis, to maintain your levels. To maintain your levels that you don't end up with very high uric acid levels, with recurrent attacks, with these things which I was talking about, the gout trophy, or kidney stones, or even the negative impact on your kidneys with kidney failure, or your negative impact on your cardiovascular, on your cardiac condition, that you end up with your cardiovascular complications such as heart attack or stroke, or even whether this is heart failure. Those things, they all work hand in hand. So these are the common mistakes which people make by just not adhering to treatment, or not seeking medical advice to really confirm whether they indeed have got gout or something else.
If there's anybody watching right now who may suspect that they have gout, what's the first step that they need to take?
I think the first step is actually to get your disease being confirmed. You go. If you've got a general practitioner, go to it. If you are using hospital services, state services, you can go to the hospital. They can look at you, or if you're using the clinics, they can they can have a look at you. And the simple thing which many people will do is, because gout is such a common condition in our country, a lot of people actually by now know what is gout like. They will help you, they will assist you to, because they've been dealing with people with this condition, they will assist you to come to a diagnosis. A simple test will just be a matter of taking blood for uric acid levels. And then some people, that if they suspect complications, they might even do x-rays. And that will actually even help you to differentiate, to actually give a name to the condition which is actually messing up your life, giving you so much discomfort and so much problems. And they will give it a name that it's gout. No, it's not gout. It's maybe an infection, and this infection needs to be treated different. Or it's maybe rheumatoid arthritis, and rheumatoid arthritis needs to be treated different. Or psoriasis, and this psoriasis needs to be treated. For everything, it's not always the same medication which works. There are certain medications which works for almost everything for all these inflammatory conditions. There are things like non-steroidals which actually work regardless of what the condition is. But it's still important to go, if you want to source specific directed medications, to go for help and for a proper diagnosis.
All right. Doctor, if you could give one golden rule for living with gout or preventing gout, what would it be?
If you've got to live with gout, don't accept that gout is just a temporal discomfort, something which will just come and then it goes away. You need to be aware that there are consequences to that. You can end up with joint deformities, you can end up being disabled, you can end up with kidney stones, you can end up with even cardiovascular. There is always an element of getting serious heart conditions or blood vessels conditions which may end up taking your life if you are not serious. And these things tells you that this is a condition which needs to be taken serious. Needs to be taken serious. If I suspect that I've got gout, I need to confirm it. And then if I have confirmed it, I need to do the things which are associated with decreasing the attacks, the gout attacks, or taking me off controlling it.
Doctor, thank you very much for joining us today.
It is my great pleasure and an honor to have been here and to be able to contribute something to our fellow Namibians.
Thank you.
Thank you.